Welcome back. Welcome back. It's episode 2 of season 1, The Foundations of Metacognition. So, episode 2, Types of Metacognitive Knowledge. We already introduced this topic last episode. So, this episode, F Scott and I are going to explore about metacognitive knowledge because metacognition is not just one thing. There's 3 types of knowledge: declarative, procedural, and conditional. So we're going to talk about each of these in just a little bit more depth so that we can help people navigate complex cases, tailor your care, be able to think about how to help different students in different ways. So the 3 key talking points today will be declarative, which is what you know, procedural, which is how you do it, and conditional, when and why you apply it. So, first of all, declarative metacognitive knowledge, the declarative knowledge. Declarative knowledge refers to your awareness of facts, concepts, and personal cognitive strengths or limitations. It's really just about knowing yourself, both as a thinker, as a learner, as a person. So, for example, I tend to jump to conclusions when I'm rushed. I tend to get too focused on the pelvis when I see a diagnosis that I'm excited about. Just things like that, just understanding, knowing about yourself. It also does include clinical content knowledge, as well as the awareness of strategies. So I know pain science education can help with chronic pain. I know that nociception is important in the processing and experience of pain. But clinicians need to be aware of their knowledge gaps. You need to know what you don't know. And if you know a little bit, that can be dangerous, you know? There's the patterns of successes and failures. These can be traps. I think these can be traps because if you keep getting success with certain things, it can lead you to think that that's causative, right? Because I did this, this is the reason why they got better. It just might be coincidental, or it might be for a different reason why it's happening. Or, you know, you don't get good success with something. You learn something or you hear about something, and you give it a crack, and no, it made them worse. Like, you got to be able to go through the thinking process of how to manage that. And preferred learning or communication styles. You know, we seem to think that we have this preference for learning. Oh, I prefer it when I do this. I prefer it when I do it. I prefer it when somebody tells me. I prefer it when I read it. And that might be true, but the evidence would seem to suggest that a multimodal experiential approach where you not only see it, you not only get told how to do it, but you get it demonstrated and you do it and you get correction on it. All of those tend to lead to better retention compared to when you're taught in the way that you prefer. So even just identifying that you have preferences for learning will help you uncover some of those BAMs and bars that I talk about: beliefs, attitudes, meaning, and stories, as well as the biases and assumptions that you have. So declarative metacognition helps you name and categorize your cognitive tools. And without it, regulation is just guesswork. How do you manage what you're not aware of? So you need to know what you know. You need to know what you don't know. Any thoughts on this, F. Scott?
Yeah, my biggest takeaways from declarative learning and what you know is, there is a lot of ego associated with that at times. So putting the ego aside, like we've talked about, right? And self-awareness, right? Brutal honesty and self-awareness. Like there's no shame to being wrong or not knowing something. You can always learn it, right? So being honest with yourself when you do these reflections, when you think about what you know and what you don't, and if you encounter certain things that you may know or may know a little bit about, like you said, that could be dangerous, right? Making sure you do the extra legwork to figure it out, to take the extra steps and to really do the deep dives on figuring out why you believe what you believe and, get it to the point where you have a good factual foundation, right? Because just because you don't know something, you go look something up real quick on YouTube or a TikTok or something like that. That doesn't mean that you know it, right? Like there's a lot of bad information out there too. So it comes back to filtering. So I think self-awareness, right, is one of the big ones, being truthful to yourself and what you know and what you don't know. And then really trying to figure out, like you said, like if there is a learning style that you're better at or you prefer, lean into that, right? Don't be afraid to try others and use others. I think using, different learning styles is always going to be beneficial. But regardless of what the research shows as far as different learning styles, pick one that you like and you feel you learn best with and lean into that and use that more often. Leave room for the other learning styles, but also just pick the one you're comfortable with. Pick the one that you've had the most success with and that you think is best for you. Because at the end of the day, you're the only one who's going to be doing the learning and then applying it. So you've got to find a system that works for you.
Yeah. And, this is the Metacognition Mondays. I've been thinking about this because my preference is actually to see it, and do it, right? That's my preference. If somebody tells me how to get somewhere, you turn left here, like I get lost. And so I thought, you know what, I've got to challenge myself. And I started listening to things like audiobooks and trying to go just by lectures and trying to figure out how to do things that way. Not because um not because I prefer it. I certainly don't prefer it. I still don't prefer it. Believe me, ask my wife. It's just like, send me a message. Don't tell me, just send me a message so I can look at it. Um, but because it's like, you know what? I do like the multimodal. I do like that whole experience. I think it's important. All right, on to the second. On to the second one, procedural, how you do it. So procedural knowledge is knowing how to apply the strategies or perform tasks. So knowing how to use clinical reasoning, for example, how do you generate your hypotheses? How do you come to your diagnosis? How do you deduce that? How do you infer that? How do you recognize patterns if there are patterns to recognize? I know that I have patterns. I know I talked last episode about patterns and how I find it hard. I know that I see patterns because I recognize things and then I know what to do. So I must see them. I just have a lot of trouble verbalizing them, especially when somebody puts me on the spot and say, "Oh, what do you see the most?" And it's like, well, I see all of these things. So I don't know what I see the most unless it's really obvious, right? Um, Procedural knowledge also includes knowing how to teach a skill or explain a concept. And I've always loved that concept of, if you can't explain it simply, do you actually know it? And one of the best ways that I've learned through being an educator has been, if I can't teach it, do I actually know it? And I think that's the challenge that I keep giving myself is how can I make it more simple? And I have certain preferences, and I found, especially early as an educator, I educated people the way that I prefer to be educated. And what a disaster that was. The feedback was good, and people thought that I was amazing, but people weren't leaving different. And, I got challenged by an educator who I asked to give me advice on this. And so she came and she sat in the course and she looked and she gave me a very brutal assessment on what she thought I did well and what I can change. And the recommendations were painful. They were painful. And I did it and it was helpful because I had to lean into the fact that my preferences are not everybody's preferences. So knowing how to teach a skill and explain a concept, hopefully I'm better at that now because I am more aware of how to teach in ways I don't prefer. Uh, Procedural knowledge is also knowing how to reflect on a case and question your assumptions. And, I often will talk about these BAMs and bars, and I think maybe I should take the time now to explain it. And that is, we go through life and we have these experiences and we use stories to help explain these experiences, to help us remember them. And those stories, those narratives that we generate, they give meaning to the experience that we have. And they help us remember the meaning, right? So if we felt really happy about something that happened to us, we will generate a narrative that almost brings up the same memories and the same feelings that we had from that. And how we do that, how we generate the meaning from that event also is affected by our beliefs and our attitudes. And so I know often what you believe and what your attitude towards something is, if you're being honest, through the stories you tell and the meaning that you take from an experience. These experiences will also change your beliefs and your attitudes. So it's this ongoing feedback loop, positive or negative, of just always adjusting your beliefs and your attitudes, your meaning and your stories about things. And, one of the classic examples of an objective event would be like watching a basketball game. If you support one particular team, there's a whole bunch of people that are happy when you win. And yet there's a whole bunch of people that are unhappy when you win because they're supporting the other side. And it's the same event, but they have very different meaning based on the beliefs, the attitudes, the meaning, and the stories. You'll see the victors talk about how awesome they were, and you'll see the people who did not win. They'll talk about the decisions that didn't go their way or the unfairness of something that happened. And sometimes it's just the other team were better, right? We can talk about that too. But the same event can generate different BAMs, and they're also affected by our bars, BAAS. I call biases and assumptions, I call them bars because we tend to flock together with the people who have similar biases and assumptions to us. And so in other areas, they call this siloing. We tend to live in silos, and we need to be aware of our biases and assumptions so that we can get out of those silos and broaden our cognitive field of possibilities, So not only is it how you do it, but back on that declarative, you need to be aware of your BAMs and your bars. So the knowledge of what to do, how to do it, is it's often experience-based, and it becomes automatic over time. People ask me how I can talk about a bunch of things while I'm working on their neck or their back or whatever. And it's like, because my hands kind of know what to do. People go, oh, how did you know that I was sore there? And it's like, because I've learned to associate what that feels like with when people are sore. And so is that story accurate? I think so. Because before I would say I could feel your pain, or I could feel this, or this is stiff, or that is whatever. But all of those things are just stories tied up with beliefs and attitudes and meaning from my biases and my assumptions about what I'm feeling means. And so it's just easier to say, I've learned to associate that could be tender for you. And you can just keep driving in on that. Expert clinicians often operate on procedural knowledge without naming it. I agree. I just described it. Metacognition makes this tacit knowledge visible so that it can be taught and refined. One of the things that I love about some of the training that I've gotten is that if you do something you can write a procedure about it. And if you can write a procedure about it, you can break it down. And if you can break it down, you can teach it. And so everything that we do can be taught. Some people just need help in unlocking what that is. And so um, I actually, you know how I said that when I see this, I know what to do? I actually went and I tried to do this exercise, and you'll find it on my course. And that is, in any movement or exercise, break down what you think every part of the body should do in an ideal way of doing that exercise. And then what you'll do if it deviates from that. And if you do that, you begin to understand all of these things that we all have. We all see these things and we all put different weight on these things. And then taking that and how you respond to that is the key. So there's one exercise for you if you like. Take a simple action like getting up off a chair. Just think about what the feet are doing, the toes, the MTPs, right? The tarsal joints, subtalar joint, talocrural joint, all the way. Go all the way up. And it's a formidable task. It's quite dense. But this is happening just over and over and over and over, in my mind at least. So I think that's how people are doing it. We just don't name it. In supervision and mentoring, this is the type of layer we want students to think aloud in. So, for example, when a patient flinches, I pause and ask what they expected to feel. This helps to surface beliefs. Okay, I wouldn't say it like that. When I see a patient flinch, I do stop and I ask what they felt, and then they can tell me. And then I can ask why, and then they can tell me. And then we can discuss whether it's like what they've had or not. And we continue to go from there. So this is part of the how to do it. Any thoughts on this, F Scott?
Yeah, I mean, I think what you said, where if you can teach something, you really have a good grasp of it, you know it. I think we like to use that a lot with students in group work, right? Like if you're going to put together some sort of presentation and you can teach it at a high level and people grasp it and understand it, then you understand it. You've got a good knowledge of it, right? And, for me, when it goes back to learning styles, I'm very much like you in that I like to see it. I like to tinker with it. I like to play around with it, especially in the business world, right? I'll just roll my sleeves up and try, like see how it goes, experiment, right? Work with what I know, apply it, and then if it doesn't work, adapt or change, right? Because I think that's very entrepreneurial minded. I think that's what a lot of entrepreneurs do is they try things, and if it doesn't work, they try the next thing and they keep trying until they figure it out. And so I think that's super important for anybody learning anything to realize that, you may have learning styles that you prefer, but realizing that everybody's going to have different learning styles is a big key. But then knowing, how we go about teaching something or how we go about learning something, right? The actual process. I use a very similar example like you do with the just getting up out of a chair and what's going on. I'll take it back even further and make it even simpler and ask them in small groups to, explain to me and walk me through how to make a peanut butter and jelly sandwich. And I'll just do it right there in front of them. And the things that they're saying and how they try to get me to make this peanut butter and jelly sandwich ends up as a disaster because I'm doing exactly what they tell me to do. And it's like, you know, all right, take the bread out. And so I'll look at the bag and I'll just rip it open and take it out, right? They'll say, all right, now you have to put the peanut butter on the bread, right? And I'll just take the jar of peanut butter and put it on the bread because that's what they told me to do, right? It's like, well, you didn't tell me to open the jar, get a knife out, scoop some out, and spread it on the bread, right? Like those are the kind of examples that I love because it really makes us think about how we do things, what the process and procedure is. And then once you can get it down, and by the end of it, we have 4 or 5 different groups that have kind of, given their knowledge and their input on it to really get down a good procedure on how to properly create a peanut butter and jelly sandwich. So once we get it to that point, now it's repeatable, now it's easy to teach, it's learnable, and then you just start doing it over and over and over again, and you just know how to do it, you know?
Yeah. No, I love that. It's I think I'm lucky. I want to acknowledge that I used to program a lot, and that's what you had to do because you can't give general instructions to a computer. Like, it sucks.
Yeah. Yeah.
Give general instructions to ChatGPT. It's not going to give you. It's going to say, I think this is what you want. Tell me more so that I can give you more. You know,
Yeah.
but when you have a background in programming, you got to do every step. Literally, go get this piece of information from here and do this with it. And I hate recipes. I hate recipes. I've got lots of recipes for cooking, and I hate recipes because in PT, because people are not recipes, and ingredients in cooking are not recipes. But you know what? It's a good start. And so, as a student of cooking, it's a good start for me to start with a recipe. But people know that you don't follow the recipe after a while. And it's like, well, it needed a little bit more of this. How do you know that? I don't know. I could just tell. It's like, okay, he's going to do it enough, right? I've been trying to make doses. Sucks. Today, after 6 failed attempts, I got one that came close, and then I ran out of batter. So next time, I hope to start at a higher level, and I just reiterate and just keep doing the iterations to get better and better. And this is that procedural metacognitive, process. So we've talked about declarative knowledge. We've talked about procedural knowledge. Let's talk about the conditional knowledge, which is when and why you're applying it. So it's using a particular strategy, using a particular treatment technique, assessment technique, question set, educational style, practical session. And this conditional knowledge allows you to select the right choices, I suppose, or the better choices for a given situation. I don't want to say the right tool. Lots of people will say the right tool. I object to this whole idea of tools in toolboxes because we are people interacting with other people. We're not mechanics working on machines. Now, I do also know that strategies are often called tools that are helpful. I get it. I just, I'm just cautious on that word tool. So making some of the better choices in a given situation, modifying my approach based on the context. This is the conditional knowledge. Avoid applying learned strategies rigidly. This is the recipe thing I was talking about. For example, knowing when to prioritize reassurance over education. Yeah, like, doctors, please. Whilst it might be truthful to say to somebody, yep, there's nothing we can do about your cancer, you're going to die, and walking out, there is nothing false in that statement. However, there is a time and a place and a way, a procedural knowledge way that you can share that information. So knowing the when and the why on how to apply it is so helpful. So it does integrate your judgment, your adaptability, your situational awareness. And, I've watched a lot of people, and I've had some patients for 25 years, and I've watched them start new jobs, and I've seen them that week, and I've seen them the week that they leave work, and I've seen them the week that they've started the new job a few weeks later, and it's like, wow, and they describe how overwhelming it all is. And then you see them a few months later and it's like, oh, it's easy, right? And the new person started. And I love reminding them, do you remember that first day? Do you remember that first week? And it was so overwhelming for them. When you start on this metacognitive process, it can be overwhelming. Just take the thing that you can hold on to and start with that. because I promise you all the other things will still be there for you to deal with later. Just like in a job, you might go, okay, if I just get these 5 things right, I'll learn how to do the other things later. And you do. It's very rare that people don't. And so being able to do that means that you can adapt. It means that you can show the judgment on prioritizing things and being situationally aware. Because when you're a student, you know, your first time in front of a patient, you're like, and the person could be giving you gold, and they're so focused on making sure they get through their list of things to do that they miss the gold. Just sit and listen. That's what I always tell the students. Just sit and listen first. Don't worry about the list. You can come back to the list. In fact, you can say to the patient, I have a list that I have to get through, but I want to listen to your story first, because that's where the gold is. You know your body better than I do. We can get back to the list. So if you have this conditional knowledge, it's going to help you evolve that one size fits all approach, because one size does not fit all. It is more sophisticated. It is more helpful. You're going to deal with the different situations, the complex, the never seen before conditions. You're going to be able to deal with that. You know, you'll be able to adjust for different cultures, different ways of presentations that you're going to see. You're going to see people with trauma. You're going to see people in different environments. You know, the way that I treat somebody on the field in the middle of an event is very different to when I treat them with a 1-hour appointment in the off season, you know? And you'll be responding rather than reacting. So my hope for you this week is, in your last treatment, in your last session with somebody, what did you know? No, you know, in inverted commas, what did you do? And why did you choose that approach? Right? Because knowing is that declarative knowledge. Procedural, how did you do that? And the conditional, why did you choose to apply that and not something else? Leave your thoughts in the comments. Would love a discussion. Any thoughts on that last one there, F Scott?
No, I think, it's made me realize that the reason that I'm fairly decent at this point at adapting and changing and evolving and knowing when to apply certain things is I just expect change. I expect uncertainty. I look at them curiously as a challenge. And that's how I approach each patient or each student or each, business decision, whatever it may be. I go into them as new challenges and what am I going to have to overcome this time? What is the barrier? What's going to, be the hurdle for this time? I welcome them. I accept them. I'm ready for them. And it's almost like a game, right? I've gamified my decision making and my adaptability. So I think that it's made me better. Now, I didn't start that way. So mind you, this is years of experience and failing and learning and getting better and attending things like this and listening and bettering myself. But I have gotten to a point now where, much like you, I just don't stress all that much in high level and high stress situations because there's only a couple of outcomes and options. So let's pick one. Let's go with it. Hopefully, it's the best, most well-educated one, and then go from there and adapt and change as necessary. So I love that little that summary there and that takeaway for the conditional.
Beautiful. Thanks for that, F Scott. All right. Lastly, please get in the comments and let us know what you think of the format of the podcast so far. You know, I've had F Scott as a guest, as kind of a co-host, as somebody to bounce ideas off and get some ideas from. Let us know what you think of that. Or would you just rather it be me? Or would you rather longer? Would you rather shorter? More examples? Less examples? Let us know what you think. And please share with us some examples from your everyday life, whether it be from work or your family, so that we can continue the discussion in the comments. If you like my style, you want to learn more about the complex made simple, please go to antonylo.com or mypteducation.com. My name's Antony Lo. I'll see you on the next episode.